Hi, Mitch Hauschel, Maximum Training Solutions. I think one of the things a lot of us face every day with our patients and our clients, our athletes, whatever it is that we work with, is poor hip mobility. And we can look at a number of different reasons for that. Typically, what I find is a lot of it ultimately comes back to a lack of stability somewhere in the chain, and we're robbing stability from those hips to make up for a lack of stability somewhere else. But we also understand that without mobility, we can't truly have stability. So from a training perspective, we've got to address the mobility issue first. So I got a number of different interventions that I use, but something I've been playing around with a lot lately is this concept of distraction and kind of this long axis traction on the joint. And what I'm finding, it works really well because a lot of times people have mobility deficits because their body's on threat. Their brain just feels threatened by the lack of stability. So it's constantly compressing the joint, trying to look for some of these different things. And so if we can get the brain to relax and come off threat, then we can start to open this joint up a lot easier. So one of the easiest ways I found to do that is with some simple distraction. And then I've also been playing a lot with rotation because I'm finding a lot of internal and external rotation deficits. And I've seen that for the last few years, especially my low back patients. And a lot of my patients in general really struggle in the transverse plane. So if they're struggling with that internal external rotation, there's a number of ways we can go after that, but I'm finding it works really well to combine the distraction with the rotation. So just to show you how we do these, you can use a number of different bands. I love the Solutions band for this because I've basically taken the handle off and I can just slip this right over her ankle, snug it down, and now that band is tight around her ankle. Now from here, I can just give some long axis distraction, and her job is to relax and start to open that joint up. And so I like to start here just straight on, and then I will also work various angles of abduction as well. And when we do that, we can start to open up that joint and get it to relax and come off threat because we're really finding those different areas where the body is locking it down. I also like to go into some different angles of flexion. So this works well to have them actually down on the floor, and we can distract that hip here. Now I mentioned I like to start to combine internal external rotation with that. So this works really well when we've got, if I've got a partner helping me out, one of my coworkers, but for this purpose, I'm just going to use my rack, and I'm basically just going to go ahead and clip this around my rack. So now I've got some distraction on that hip. So from here, I can start to work various degrees of internal external rotation. I like to have one hand down here on the foot, the other one up on the knee. And so I'm just trying to really internally rotate that hip, externally rotate that hip if that's where they have the deficit, and we can start working through it there. And I'm just on, off until I start to feel that hip really relax. I also like to work that in various angles as well. So I'll come here, various angles of abduction and then also flexion. So I can do that with my rack as well and basically come up here high with it. Clip it here. So now I'm starting to get some traction here at that angle, and I can start to work various amounts of rotation with the hip there. And start to play with those various degrees, various angles, and then start to look at some of that rotation. I think you'll really find it's a good technique to help you start to open up those hips, especially with rotation where a lot of our patients are really having their deficits. So try this out. If you want any more information on any of our other various posts, injuries, products, things like that, check us out at MaximumTrainingSolutions.com.